Choosing the right treatment method is often difficult. Today, oncologists have a wide range of tools at their disposal. When choosing one of these tools, it is necessary to consider the individual characteristics of the clinical situation and always recommend the patient the best treatment method for their case. For example, radiofrequency ablation always works well for small tumors. Its principle of action is based on tissue heating. Microwave ablation causes the water in tumor tissue to boil. Therefore, if there is no water in the tumor tissue, microwave ablation will not provide a good result. Additionally, microwave ablation is more effective in treating tumors located near blood vessels. Cryoablation freezes tumors and stimulates an extremely powerful immunogenic effect, while it is absent with radiofrequency or microwave ablation and completely excluded with surgery. Therefore, cryotherapy facilitates a much better presentation of antigens to the patient's immune system for immunotherapy. The same applies to electrochemotherapy, which is also highly effective in improving and enhancing the therapeutic efficacy of immunotherapy. Electrochemotherapy is an intratumoral therapy method based on the effect on DNA. It causes DNA double-strand breaks, similar to high-dose radiation therapy, while cryotherapy, microwave ablation, and radiofrequency ablation do not have this property. Our range of services includes, for example, interstitial brachytherapy, which is a highly precise method of internal irradiation for tumors with clearly defined boundaries, and the use of gamma radiation from the radioisotope iridium-192. So we have the ability and the expertise to view these therapies as different tools for helping patients. I think you've heard the saying, if all you have is a hammer, everything looks like a nail. That shouldn't be the case in interventional cancer treatment. Instead, we need a diverse range of therapies to treat highly vascular tumors, tumors of a certain size, or hard-to-reach tumors, so that we can ultimately treat them effectively without causing collateral damage. Last year, we also published scientific papers on this topic. Using liver tumors as an example, we investigated which treatment methods are most effective for providing local tumor control in different types of neoplasms. Ultimately, we were somewhat surprised by the results, which showed that even new treatment methods, such as electrochemotherapy, provide very good results and allow achieving excellent local tumor control, especially for larger tumors, despite their novelty. Ultimately, the type of tumor, its blood supply, size, location, and microenvironment, the environment surrounding the tumor, play a decisive role in choosing a treatment method. Additionally, tumor infiltration, a topic we have already discussed, ultimately determines the volume of tissue around the target cancer lesion that must be affected to ensure an adequate level of treatment safety. Regarding tumor size, I would like to focus on calculating tumor volume. Many old publications only discuss the maximum tumor diameter. Unfortunately, this is not enough to estimate the tumor size, because we cannot assume that tumors are spherical or elliptical, as is always stated in publications, textbooks, or company brochures. In reality, this is almost never the case. As a rule, tumors are irregularly shaped. Their entire architecture is characterized by certain expansions and adaptations to the surrounding anatomical structures. Of course, to ultimately avoid inaccuracies during therapy, it is necessary to take into account all the features of the tumor morphology. Therefore, it is very important to calculate the tumor volume, because knowing the tumor's architecture features allows you to select the appropriate treatment method for the patient. Technically speaking, there is a distinction between interventional procedures that use only one type of probe, such as radiofrequency ablation. This is because it is impossible to synchronize different types of probes during these procedures. As for procedures such as microwave ablation, cryoablation, brachytherapy, and electrochemotherapy, it is possible to synchronize several types of probes at once to enhance the therapeutic effect. This is very important in the context of eliminating certain deviations in the architecture of the tumor. Thank God, doctors now have many options at their disposal. These options must be used with experience prudence, and understanding to achieve the best therapeutic results. In this regard, it is also necessary to distinguish between the calculation of the tumor volume and the size of the safe space for affecting the tumor, which would allow the penetration of tumor-infiltrating lymphocytes into the oncological focus. Because lymphocytes act as a protective mechanism of our body, preventing the invasion of tumor cells. These are all incredibly interesting aspects, and we have a lot of serious work ahead of us in the next few years. However, this is only for the better because the possibilities of minimally invasive therapy should only expand in the future. Ultimately, you can always find the best treatment option. More precisely, the most appropriate treatment option must be selected for each specific clinical situation. For example, performing thermal ablation near the liver capsule will certainly cause severe pain. Therefore, in this case, cryoablation would be a good option because it is a painless or significantly less painful procedure. If duct structures such as bile ducts or blood vessels pass through the tumor, the goal is obviously not to destroy them, but rather to destroy as much of the tumor as possible in this area. In this case, electrochemotherapy should be considered. Of course, the tumor's structure and blood supply must be taken into account to ultimately prevent its disintegration. At the same time, it is important to remember that embolization to reduce the blood flow to the tumor before treating highly vascularized tumors is not only effective, but also a justified measure in terms of the risk of complications.